let me start with my introduction. I am Ashish. I have joined you from Hyderabad. I am the founder director of MEDGINI, and this podcast, which is brought to you by MEDGINI, which is Pharma Talks, which we have been doing it for more than 1.5 years. This is the 23rd webinar. Coming to my background, I have joined from IT and telecom before coming into pharma in 2012. And I get an intense experience of not only India plus Middle East as well as African geography, where I have worked extensively. I have done my MBA in marketing communication from Symbiosis Institute of Business Management. So apart from work, I am really passionate about cycling, dancing, and reading. So these are my hobbies. I stay along with my parents, my wife, and children's in Hyderabad. So this is a little background about myself. And we have today two great speakers who are joining us from the industry to value add on the subject, to talk from the experience that they have lived with in terms of handling great brands. So if you are excited to welcome our two great speakers, the first speaker, let me get him on board and let us take his introduction. Mr. Manish Trehan. Manish Trehan has joined us from Aristo, Mumbai, and Mr. Arish Trehan is the General Manager Marketing at Aristo Pharmaceuticals Private Limited. Mr. Manish Trehan brings rich experience from leading pharmaceutical organization with over 3 decades of experience in sales and marketing. Throughout his career, he has successfully driven brand growth, improved profitability, strengthened trade marketing strategies, and enhanced sales force performance across different geographies in India. He is known for his practical approach to strategic marketing, smart portfolio management, and market expansion planning that delivers real business results. We are excited to have him with us today and look forward to gaining valuable insights from his extensive experience in trade marketing. Welcome, Manish sir.
Thank you so much, Ashish ji. Thank you. Such a pleasure to be a part of this webinar.
So 3 decades of experience, sir. I would just like to ask you one thing before we move to our second speaker. What has been the best year in your career in terms of growth and learning?
Very difficult to choose between your children, all your children are dear to you. Likewise, almost more than 3 decades I've spent in this industry. I think every year has been eventful. Every year has added value to my capabilities. Every year has led me to higher pedestrian. So it's very difficult to choose. But I assure you one thing, that every passing year, the last year becomes the best.
True. Well said. Well
Thank
said. Well said. I agree to
you.
you, and we are so excited to have you here. Appreciate your time
Even
uh,
me,
with it. Yeah.
even me.
Thank you so much. So with that, we are here excited to get our second speaker on board. And our second speaker for today is Mr. Govind Pathak. Mr. Govind Pathak, we are pleased to introduce Govind Pathak, currently serving as a brand manager at 𝐓𝐫𝐚𝐼, one of the India's most respected pharmaceutical companies, as we know. He specializes in developing strong brand positioning strategies, currently managing respiratory portfolio and executing high impact marketing campaigns backed by thorough market analysis. His ability to integrate sales and marketing coordination enables consistent on ground execution and measurable commercial growth. So he has been recognized by 𝐓𝐫𝐚𝐼 brand story. He has got a gold award. He has also been recognized by MIMS as a best patient-centric campaign. So the third recognition what he has is Economic Times Shark Award 2023 and Interlink Gold Medalist. He has also been recognized by Pharma Connect as a Best Strategic Innovation Award. So Mr. Pathak has completed his digital marketing for performance and growth from Indian Institute of Management, Kozhikode. He also holds PGDM in Pharmaceutical and Healthcare Management from IES Management College and Research Center and a Bachelor of Pharmacy from University of Mumbai. Apart from work, I was discussing with Govind. He says that I am in love with badminton. He's a national level player. So we are so happy to have you today. Govind, over to you and your thoughts in terms of this current state of pharma marketing, though we'll be discussing in detail. How are you excited today to be with us?
Yeah, I'm very much excited to be on this particular panel with you and Manish sir across. Hoping we had a very thoughtful discussion, and obviously I encourage the audience also to put in the questions across. And like let's make it a very successful webinar, and your inputs are highly appreciated. Thank you.
Thank you so much, Govind. Appreciate your time on being with us today. And with that, I would like to introduce the topic of today, which is trade marketing, new age strategies. Trade marketing, as we all know, has become complex, and there are multiple channels of business, be it online, offline, quick commerce, e-commerce, where pharma marketeers need to make their product present in all the channels. Keeping that as a major challenge for all the pharma marketeers, the broader aspect of today's discussion with the limited time that we are having today is on segmentation, targeting, and positioning. So these are the three areas that we are going to deep dive today with our speakers. And as I told you, we will be touching about availability, retention, as well as scale of business and how to fight competition from generic medicines. So we'll be diving dive in today. But before we proceed with our speakers, the one question which I would like to ask our audience is, if trade marketing or trade offers are stopped tomorrow, would your brand still sell at the retail counter? So I repeat my question. If trade offers or schemes are stopped tomorrow, would your brand still sell at the retail counter? Please type in yes or no in the chat. Please be active in the chat and keep your video on, and take as many notes as possible. Though we'll be trying and converting this into a ebook, but keeping notes really help you in terms of getting the points executed the early you can. So please type in the answers. Yes. So there are people who are answering. Suryakant says no. And we have Selva who says no. Sanjay says definitely no. Tushar says yes, but with certain impact on the sales out. So yes, Tushar believes that trade offer schemes are important, depends on the demand and the brand recall. Rakesh says only if the brand is solving the problem. Great. Alok says yes, opportunities to be more. Right. Perfect. So with that, we would like to invite you to participate into a scoreboard activity where we have we and our team, along with the guidance from our guest, Mr. Manish and Govind, we have formulated a audit where we would like to give you as a scenario in terms of where do you stand today when it comes to trade marketing practices. And I would invite you to please scan the QR code, participate. There are simple 10 questions. Along with that, there are three multiple choice answers. There is no right, there is no wrong answer. Please participate with honesty and you will get your current score. The person who participates the fastest and confirms to us in the chat will be winning a book from Subha Rao. The book name is Sentiment Analysis. This is a so this is a hard copy which will be delivering to your doorstep. So two winners will be selected among the many people who will be participating. Irrespective of the winning prize, I would invite everyone to participate so that you know currently where do you stand. So please scan, and by email you will also be getting your report in terms of your answers and what are the areas of improvement. Obviously, we can sit together and see how best we can help you out. There are many areas that we are going to discuss today in detail, but I would invite you to please participate. My team has put the link in the chat. Yes, Tanmay has already participated, I guess. Yes, great. Thank you so much, Tanmay, for confirming your participation. And yes, Nilesh is also done. Right. So if you are done, please type in done in the chat so that we get, so we give about 5 minutes for completing this assessment activity. And then we deep dive with our speakers in terms of the various aspects of trade marketing, best practices on segmentation, targeting, and positioning. So there will be real life examples which will be shared by our speakers and also observations based on the experience that they have handling power brands in their current portfolio. So with that, we will be moving forward. So we have just about 5 minutes. Please participate and do remember that the winners will be announced end of the webinar. So please be there with us. The ebook which is going to be crafted exclusively, no YouTube Gyan, no chat GPT GAN. This is a GAN which is going to come from the experience of Mr. Manish and Govind, and which will be translating into a ebook format, which will definitely be helping you in your business. So with that, I invite everyone to be attentive. Please keep your videos on. So we've got about 6 questions that we intend to address today. And any questions that you have, please put in the chat and we will be happy to take it up at around 1 o'clock once we are done with the 6 questions that we intend to ask. The 6 questions are also based on the feedback that we have got from the previous webinars participant. This is the 23rd webinar that we are doing, and very soon we will be touching our silver jubilee with your support. And we have been blessed to have experts participated as speakers in our previous webinars on interesting topics, and people who really want to catch up on our previous webinars. My team will be happy to share the link to you, which is available on YouTube as well as our website. This is purely the intent of doing this is to know the industry better, to understand the needs, challenges, problems that you're facing. So great. So we got many people confirming that they have done. Yes, more than the score, I think it is about the participation, where we wanted to understand whether you have got value in terms of being there with us. Great. So with that, we move on to our the first topic of today's webinar. The first question which I would like to ask Manish. Manish, based on your particular experience, how can companies solve product availability issues where prescriptions float and are not honored at the attached pharmacy? So this is a very important concern which I keep hearing from marketing teams of various pharma companies that we work, that prescriptions are not really honored at the attached pharmacy. We have seen 80% of the medical stores are floating counters. So how are you solving this puzzle, Manish sir? Can you please give us some guidance?
Yeah, sure. Thank you, Ashish, for the question. And
Yeah.
I would like to say that let us see how the pharma marketing is all about. The pharma marketing is about meeting the doctors, taking their prescriptions, and the prescriptions getting honored at the chemist counter, right? Now, we have close to 9 lakh chemist counters across the country. This is our data says. A division which is one of the best divisions of the industry would be having about, say, what, 1,200 people, maximum 1,300 people. It's not possible to cover 9 lakh retailers by 1,300 people. So one thing is for sure, that personally, our people cannot reach everywhere. So what is the way that we ensure that our prescriptions are honored at every chemist counter? I think the only way is there are 2 ways which I follow, which I advocate everyone to follow. Number one is assess and gauge the extent of your brand equity, brand character, and brand loyalty at the level of your doctors. I once again repeat, first comes what is the extent of your brand character, brand equity, and brand loyalty. It looks very strange, that we are talking of retailers, but I'm talking of brand equity. But trust me, or to all the participants, that it matters. If your brand equity is strong, if the trust of your doctor on your brand is strong, your prescriptions are going to be stronger. Your prescriptions are going to be bigger in terms of the quantum. The doctors are not going to allow the brand substitution. They're going to tell the patients, मैं लिख के दे रहा हूँ यही लेना. And why would the doctor say it? He will say because he has got a trust on your brand. So you build the brand character, you build the brand strength, and you can be sure that the prescription's quantum is going to be better, and the chemists are not going to substitute us. Why? Because they have the stocks at their counters, number one. And number two, they are not going to do it because over a period of time, even he has a very positive feel about your brand. He knows that this is a good brand, not worth substituting. In other words, I can also say that if your brand prescriptions are coming out of conviction, then that conviction of a doctor is going to translate to a consideration at every level. The chemist is going to consider your brand as a good brand and he is not going to substitute it. So the first most important thing is build your brand character. That will help your brand not getting substituted at any chemist counter. Number two important factor is that what is the extent of your depth of your relationship with a chemist? Even that matters. When you go to a chemist and talk about your brand, most of the times what you talk about is how much prescriptions have I got? Are you having the stocks or not? Has a demand coming down or coming up? That is the usual mathematical questions we ask to a chemist. How many times do we ask or tell a chemist about our brand character? How many times do we tell him about our brand story? How many times do we talk to a chemist about the brand quality or the equity that we are having? Usually we don't. We confine that information to a doctor. But to a chemist, it's only mathematics. कितना आया, कितना बिका, और भेजूं क्या? Change it a bit. Change your narrative or tone a bit. When you go to a chemist, although I understand that you will not be able to visit all chemists, but eventually over a period of years, you will meet more and more amount of retailers. Try to build a story for your brand even at the chemist counter. Talk to them. What is the quality of your brand? Where is it manufactured? What kind of raw materials do you use? Because when you build a story, the chemist also builds that story. And in his mind, your brand stands above the commodity. And always remember, friends, only commodities are substituted. Brands are never substituted. Brands' prescriptions are always honored. So
Absolutely.
these two things, if you take care of, they're going to solve all your problems. Number one, keep on building your brand equity, brand character. And in front of a retailer, always narrate a story which makes your brand stands apart, which builds a connection in the mind of a retailer for your brand. And trust me, he will never replace it. He will never replace it. On the contrary, he'll tell a patient, मेरे पास खत्म हो गया है. You wait till the evening, I'll get it and I'll send it to you.
Absolutely.
And this we have seen practically happening. This is my take
So
on
very
your question.
powerful point which you have told us and which is being resonated by our people here in the chat as well as the reaction. Thank you so much, Mani sir. The one thing which I have also observed, many of our companies to whom we work or service, they are very particular about which are the type of outlets that they are actually servicing, what are the characteristics of the outlet. So not all outlets are the same. So we are talking about outlets which are small, medium, large size. So they actually have a very strong data of the outlet they are actually servicing, and post which they have a proper detailing plan in terms of how to go and how to approach them. So we'll be deep diving into it, but this is something which I have learned from our customers, that they have now started building up a strong retailer database where they want to understand the last mile of fulfillment of sales happens at the chemist. and who is the person, what is the characteristic psychographic of that particular person. So there is genuine effort which is actually being made by many companies to understand the last mile of fulfillment of sales. So this is something which we are learning. So with that, the second question which I would like to ask our speaker, Mr. Govind, is on again segmentation. So we are going to deep dive into the second aspect of segmentation. Govind, the question that we wanted to understand with you today, companies like Cipla, who are known to be forward thinkers when in terms of digital adoption. So how can digital tools enable companies to go wider and more efficient when it comes to chemist coverage? As what Manish was telling, there is a limitation of manpower. So how are you solving this puzzle? Over to you, Govind bhai.
Yeah, thank you so much. And I think so. This particular question is basically need of an hour, where we can see the companies are rapidly taking up or evolving into this particular digital segment after the COVID era. And when we basically speak about this digital aspect in pharma trade marketing altogether, it's not just in technology. The visibility parameter comes into the picture. And if I'll have to correlate it with the chemist reach, as of now, it's not only about the chemist coverage or the trade coverage which is there. It is about the trade relevance. No doubt, our particular field colleague is basically visiting 10 to 20 trade counters on a daily basis. But how much is it relevant? That is very much important. And to make that particular visit or to make that particular encounter or that relation validated, the digital aspects or those particular things basically come into the picture much more efficiently. And if I'll have to speak from a digital tool angle, the decision intelligence of that particular marketeer and the field colleague is very much important at this particular point of time. Now, CRM calls or the CRM tool that basically monitors the calls, that is not only efficient from a doctor's angle. If I'll have to elaborate on that particular point more, there should be a proper class of the chemist, which or the categories of the chemist which needs to be developed. Like the same way we have got A plus doctors, B doctors, A doctors, C doctors. In those same parameters, the chemist also needs to be identified. There should be a double visit, single visit, which needs to be put forward on those particular chemists. And for example, if I'll have to say if a territory is showing a high prescription trend, we are able to analyze that there are a good number of prescriptions floating it. But when we correlate it with our secondary sales, it is completely flat. And our first tactic, which any traditional marketer would think of, let's put more schemes, let's introduce more offers, the chemist will cater our particular brand more. That is not a story. You will obviously manage the moment, but for the long-term aspect, if you're thinking about a brand to convert it into a big brand, bigger brand, or a mega brand, this particular issues will never solve your problem. It properly relates, as basically said earlier by Manish sir, your brand should tell a proper story which relevates or which is relevant with respect to your brand on a day-to-day basis. Because the second most important aspect for a pharma marketeer after doctor comes the chemist. And your repeat purchase completely depends upon that chemist. If he is resonating with your brand, if he is resonating with your brand story, obviously he will never substitute that particular brand in near future. And there are three more things which basically come into the picture: the precision coverage, the speed of response, and the measurement discipline, which go basically hand in hand. Okay, so just to sum it up, a proper identified niche, or I can say a focused approach towards those particular high retail counters or the high chemist counters is what is basically the need of an hour. Digitally, obviously, will never replace our field colleague. It will just empower them to guide more and have a very focused approach towards those counters. Yeah, that's it.
So, Govind, just to ask you a little more about categorization, you have just mentioned that pharma marketeers should look at categorization of chemists. So, as per you, you have been handling respiratory portfolio in your current assignment. If you were to do categorization of a chemist, what will be that aspect of categorization of a chemist? Is it demographic, psychographic, or the type of chemist, or what is your thought on categorization of chemist?
See, from a categorization window, from marketing aspect, if I'll have to ask, I'll basically try to target those particular counters where I know the prescriptions are getting floated. There's one big counter which is associated with a hospital or any doctor clinic, and there are some small counters near to that particular chemist. One prescription at that particular counter, as soon as that prescription floats into the market, the other chemist counters ensure that at least they have got one or two strips of that particular brand into their particular shops across. So, from a categorization window, if I'll have to say, I will obviously target the high value counters or the floating counters much more efficiently, and then basically deep down them into the A plus, A category, B category, and the C category across. The visit also can be done accordingly, however it is feasible. But yeah, this will be my way of segmenting those particular chemist counters across.
Great. So, great. So, based on
Ashish,
sales is what you are saying. Manish sir, what exactly is your definition of
yeah,
categorization?
I was coming to the same point. Govind, I have one very interesting way of categorizing the chemist, and I've been doing this since I was a medical representative,
Okay.
and now I've been teaching that to my subordinates and my colleagues and also my field staff. And it's very interesting. You won't find it on books. I categorize the chemist into three categories: category A, B, and C. Category A are the chemists who are very honest chemists. They will always try to honor every prescription. They will not substitute the brands. And they have a reputation in the area. If they're in a town or if they're in a small periphery, they have a reputation. उसके पास जाओगे तो जो लिखा होगा वही देंगे. These are
Absolutely.
the first category, which are said to be the prescription honoring chemist.
Hmm.
The second chemist, they're very interesting ones. They're very good to talk. They're great influencers, and I call them patient influencers. They will decide the honoring of a prescription looking at their patients. If the patient is very close to them, they will try to influence him. Oh, the doctor has given this. What if I give you something else? It is equally good and it will work well, and maybe it is more reasonable in price. So they are the patient influencing chemist. They are also very honest. What they try to influence is many a times for the benefit of their patient.
Hmm.
But many a time their influence can go against you
Yeah.
because they may be influencing the patient for some other brand. The
True.
third chemists are the most difficult one. They are the substitutors. They will not look here and there. They will go by, just substituting it, giving it to a patient, unless the patient says, "Arey, aap kya de rahe ho?" But we know the reality today. How many patients can really read the prescriptions?
True.
So, according to the category, you should treat the retailer. If he is amongst the A category, always the honest ones, make it a point to thank them once in a while. You can give them a small certificate of appreciation. Take it from your organization and give it to them. They'll feel very, very honored that somebody, has given them that recognition that I'm honest. And honestly, many of us forget to do it. Second comes the B category. Here your relationship is going to work. Your brand stories that you narrate is going to work. Your stories of your quality, the story of your factory, the story of the fact that the brand is going to give the best therapeutic response, unlike the other mediocre ones. That is going to play a lot of difference. The third one, usually I don't touch. Although I must say the third one is not very substantial because any chemist shop today, they work on the equity. They also work on the credibility. But all said and done, there are 20% of these retailers who are of the C category. You won't be able to do much. You'll have to either match the offers or you narrate your story and leave it on to them to do it. So, so that is why I say that more than scheme marketing, we have to get into influencer marketing. And this influencer marketing works at all the three chemist counters.
Absolutely. That's
That's
a
my
very
take on the
powerful
subject.
statement. More than scheme marketing, work on the influencer marketing. That I
Right.
think leaves the impression what exactly marketeers need to do intentionally at the chemist counter rather than chasing offers and schemes of your competition, which is never-ending chase. So,
That's never ending because, and I also tell you, Ashish, very important observation. There was a study from the Competition Commission of India. It was on the chemist and the retail marketing and overall pharma marketing.
yeah,
That airline something very interesting, It said that the chemists do substitute the brands many a times for the benefit that the brands are giving them. That we all know. That's a harsh reality.
yeah.
But it also gave a practical takeaway point that the moment you try to, you know, equate the bonus offer, you try to high your bonus offer and give it to the retailer, your brand equity takes a beating.
Hmm.
So it's a very calculated, move that you must make because the moment you keep on giving, matching the bonus offers, making the retailer happy, you're losing your equity. You are declining your brand from being a brand to being a commodity, and that harms you in the long run. So do it very calculatively. And
We
Absolutely.
that
have
is why I'm a very strong propagator of brand equity.
completely agree. Actually, we have burnt our fingers in my past assignment on this, where we tried to have additional bonus offers to counter that seasonal aspect. But as soon as the season was gone, we it is a harsh reality, and I'm not shameful of accepting it. But yeah, we have burnt our fingers on those particular parameters. The brand
Trademark.
equity was lost. We basically had to narrate the story once again, and we had to bring in some different aspect to basically cater that brand altogether.
Yeah, so true.
Govind,
So
that
with that,
happened with us also once, I must tell
Mhm.
you. There was a
Mm.
brand with us, which was not a very, very big brand, but still a good sustainable brand. We thought that let's give it a try and we increase the bonus offer. The brand sales jumped 4 times in a month. But you know what happened? In the next 4 months, it was all plateaued. So at the end of 5 months, the average sales of the brands were almost the same as the first month. So what did we
you
gain?
just prepone
We
your
didn't gain
sales.
much. So so that also you have to be very careful. Many a times they'll stock it, but they will sell it only, as per the demand comes.
Absolutely. So
So
demand
again,
generation is
work on the
equally
demand,
important, right?
work on the equity.
Perfect. So with that, the second aspect of today's webinar, we are going to talk about trade marketing new age strategies, which is on targeting. So now that you are clear about which outlet you want to target, Manish sir, we would like to understand from you, based on your experience, what strategies can companies adapt beyond traditional offers and schemes? So in the entire discussion today, you have been advocating our people to look beyond offers and schemes. So can you share us some real insights in terms of if I need to really have chemist as a partner to our business from a long-term perspective, apart from traditional offers and schemes, what can I do so that he's hooked on to me?
Very nice, Ashi. That's a very, very relevant point, and I would be happy to elaborate on it. First, I would like to give all my participants a small example, and that's a real time example. Two people are working at different headquarters, person A and person B. Different headquarters, different set of doctors. One person has got very strong sales. He's always ending at 110%, 112%, always giving a good growth. And whenever you ask him, don't you have the problem of chemists substituting your brands? He will never say yes. He will say, no, it's okay, they never do it. I've got good relations with everyone. Great. Come to this person B, ending at 95%, 96%, giving a growth of meager 1, 2, 3%. You ask him, what are your issues? Chemist doesn't stock my goods. Chemist always substitutes my brand for higher bonus offers. And I'm sure that you would relate this story with your respective companies also. Why does it happen? Very simple. It happens because the person who is successful has built his story very strong at the level of doctors and also has a very strong story at the level of the chemist. And the other person, the story is a weak story. So again, coming to point one, make a strong story, weave a strong story for your brand, for your company. It will help you. Now coming to what can we do at the level of chemist, what Ashish ji said. So I like to narrate that there was a study which was done, which is called the strategies at the chemist level. This was an academic paper which was made by a survey done in Delhi, and it was various important chemists of the Delhi were involved. And this survey, it's available on the internet as well. This survey says that chemist had two or three objections. The chemist had objection number one, that most of the pharma company are focusing only on doctors. They don't focus on us. Their CRM or their customer relationship management is confined to doctors. They ignore us. Second is that many of the times, if your brand is unavailable, if there is a problem in the distribution chain, then the substitution is bound to happen. And the third is the lack of touch points. If you have good touch points with a chemist, the chances that your brand is substituted comes down drastically. So what strategies do you have to improve your prescription honoring? The strategy at the level of chemist is touch point, touch point, touch point. Do you have adequate touch point with your retailers? Now, touch points, as I told you, you can't touch everyone physically. But then there are digital means you can touch the retailers. Number two, there could be educational initiative that the companies can undertake. Although that idea is still nascent, but this can be advanced. Every chemist shop, he is not hungry for margins. He is hungry for knowledge. Can pharma company, extend a helping hand in imparting the knowledge which helps them? And that knowledge necessarily is not about only, the it's about your brands. It can be the knowledge on accounting. It can be the knowledge of general mannerism. It can be how to emotionally handle the patients. It can be how to be a more effective counter. There's so many ways. It can be on Excel. It can be on PowerPoint. It can be on how to be good parents. Simple things. And nowadays the courses are available so cheap. At 75 rupees, you can get a course of a certified course available on internet. Can't we give it to our retailers? Let's think on the ways, and I'm sure we'll be able to have more touch points with our chemist. And once a chemist is going to be hooked by your touch point, he is not going to forget you ever in his life. And I think that he's going to help you, your brands, for the lifetime. But many a times, yes, as that study said, we ignore the retailers. We should not.
Absolutely. I
Uh,
think,
Going ahead, I'll say that relationship building. Try to build relations with the chemist. You
hmm,
know, ask him that how can you help him better? And
hmm,
I'm sure he's not going to talk of bonus offer. He's above that. Bonus offer somehow we dump on him. You ask him what do you want, he'll ask something qualitative. Try
right.
to help him there. And
Hmm,
I'm sure that these touch points which we create either through the digital way or through personal ways is going to go a long way in shaping our brands at the level of the retailers.
True.
And we must tell our medical representative, our field force, to send the information to us what these retailers are speaking. Because if our ears are open to the information, I'm sure our heart and minds are going to be much more receptive. Always remember, dear friends, that if your medical representative or your field force gives you the information what has happened, then you are managing the past. But if they are giving you the information of the latest trends, then you're shaping the future. So we have to
Absolutely.
train our field force also how to go about it.
So yes, so I think chemist engagement in terms of doing business beyond business is something which you have beautifully
Absolutely.
narrated
Absolutely.
examples, and it is easy to do. Just that the intention should be there to do it, and we have a field force who are more than happy to execute these kind of campaigns. So a follow-up question to Govind on the aspect what we have been talking today on targeting, getting good insights from Manish sir. In this new age, trade marketing, how to train medical representative. We understand that there is a quality issue, there is a quantity issue when it comes to medical representative, but they are the point of contact today. You like it or not, they are the point of contact today who actually meet the doctors, meet the chemist. How are you going to actually train the medical reps to build strong chemist relationship beyond transaction? So please tell us, based on your experience, how did you solve this?
Okay, so for me, if there are two parameters, like if there are two plates, one is from a strategic window and one is from an L&D window, I'll obviously cater the L&D window first. Rather it be in the doctor front or the chemist front. L&D is what is basically I've taken obviously as a first choice, correlating it with the execution parameter. And what I have observed from the trade marketing window or the chemist relationships, they generally fail when it is basically scheme driven. I am a local company or I am giving you a bonus offer of 10 plus 5, 10 plus 6, which is very much higher than the national overall the bigger companies. Then you will obviously cater that 1 or 2 months, like as we discussed earlier. You will obviously have those 3, 4 months fruitful for you, but eventually you will basically lose. Mistake is done by the few companies as well. They start evaluating these particular MRs on the order booking, how much order they are basically booking from this particular chemist counters. If he has got good chunk of orders or basically high potential market, if he has got his territory into, he's a very good field colleague. But that is not to be done. And if we start incentivizing on those particular transactions, you will get transactions, no doubt, but you will lose the loyalty. So I generally obviously always say ki start incentivizing on those relationships. You will get the loyalty. As soon as you get the loyalty, the brand relation with that particular MR, with that particular company, with that particular doctor and the chemist, and this whole cycle will start running, and it will be an endless cycle. Once the relationship is built with that particular field colleague of that company, with the doctor and the chemist, no doubt, I dare you, any chemist counter will never substitute that brand for any condition the doctor prescribes. And from a strategic window, if I'll have to speak, there will be three parameters what I basically consider key from a training window that will be very much responsible for trade marketing. First, obviously, we'll have to understand that the person standing on that side of a counter, he is also from a science background. He has also put 2, 3 years, 4 years into pharma field, and then only he is basically standing on the other side of the counter. He understands science. So that category thinking or having a small elevator pitch, like hardly 10, 12 seconds, I can understand at the chemist counters, we don't get that much time. We obviously have to do our usual RCP also. But at 10, 12 seconds or at 15, 20 seconds, the elevator pitch, which speaks about your brand, which basically sets a narrative for your brand, that is very much important and which I think is a need of an hour for all the companies across. And only instead of pushing one SKU, you create a basket. Think from a category window. Second, obviously, having a prescription protection mindset. The chemist should not feel the products are getting dumped into me and now it's my responsibility to liquidate this. As soon as that responsibility come on the chemist, he has got thousands of the stuff to do. And the same number of field colleagues visiting the doctors, obviously the same number the chemist also will be visiting. So we'll have to understand from that window also. Have a prescription protection mindset. The chemist should feel that they are protecting the rotation. And from the rotation, I basically means ki tactically you put 9 to 10 boxes into that particular chemist counter, and every week you go ki khali hua ki nahi, khali hua ki nahi, agla order le lo. That mindset should not be there. That's what I feel. And last, obviously, the commercial understanding. That obviously is a very much important aspect for a particular field colleague, which is very much necessary. Brands generally rotate faster and don't lose prescriptions if they have got a very good loyal relationship with the chemist counselor. And obviously, the relation basically should shift from big bargaining to business planning. And business planning obviously will only cater these three parameters which we spoke as of now. Yeah.
Well said. I think points are well understood, and we will also be taking up at 1 o'clock where people are really asking you to give real-time examples. So we'll be moving forward with regard to today's webinar on the third aspect of today's discussion, which is positioning. Now that we are clear about segmentation, we are clear about positioning. Manish sir, what audience would like to understand from you? Trade partners, as we all know, are an important channel for our business, and you get information from trade partners. How can companies really leverage this in a systematic way where you get information which will help you be ahead of the race? So, do you do this judiciously or it happens just like that?
Okay. So how can we leverage our retailers, our chemist counters to get information and stay ahead of the competition?
Yeah.
That's a very relevant question. Uh, uh, Training the field force to ask relevant questions to the retailers is very important. As I told you in my earlier deliberation also, let's not teach our people to ask mathematical questions only. Let's ask qualitative questions. And before we ask qualitative questions, it's very important to have that understanding, that parity, and that equity at the level of the retailer. You have to treat him a human, and he has to treat you as a human, right? And the questions that should be asked should be uh, uh, any change in the trend he's seeing over a past few weeks or few days. Uh, any reasons of that substitution is increasing or decreasing? Distribution chain, is it proper or not? Are there any shortages? Is he facing any issue in terms of getting the stocks from the organization, from the stockist? Any expiries are not there. He's not facing any losses in terms of the expiries. So little more qualitative questions. And as I've narrated earlier also, the best way to, derive equity, the best way to get information from the chemist and leverage the relationship is, let's create meaningful touch points with them. Let's try to give value every time we meet them. And that value is going to be the value of information, the story that we narrate to them, and there has to be a connection that is forged between the chemist and the field staff. Some examples I have to give. We have our brand, very age-old brand, Aristozyme. It's small thing. Some of our field staff, when they go to the chemist, they tell him that you sell so many enzyme. But do you know why Aristozyme is so different and so special? And they show him that it is absolutely clear. Many a times they will take out a test tube or a glass, pour a little bit of Aristozyme, show it to him, see how clear it is. This clarity gives good efficacy. And then they can offer that glass, it's a disposable glass. They can offer that glass to the chemist, drink it and see the taste. He drinks it, he finds it very good. Now, don't you feel a connection is forged? Now, next time, will he dare substituting Aristozyme with any other Tom, Dick, and Harry brand? Maybe no. Similarly, talking of a 𝐲𝐿 that we have, Mega CV, it is wonderfully packaged. Just showing a packaging of 𝐲𝐿 to him and showing that what a beautiful and strategic packing it is and how it protects what is inside and how that helps the patients and how that helps takes away the sorrow, the infection of the patient better. Don't you think that forges emotions, that that brings forth emotions? Will he ever substitute Mega CV? And I'm sure that we all have such stories with us. How many times do we share it with our chemist? These small little human tactics, these small little, things, they try to bring out the best from our channel partners. The best I'll say it is that don't consider chemist as a last chain of the distribution chain. Consider him as the first, most important one. If doctor are gods for us and we treat them as Lord Ram, I think chemists should be treated as Hanumans. And we should realize that they are the one who are going to be our success partners. With these feelings in our medical representative, in our pharma managers, I'm sure things are going to be much better for us in times to come. So, from scheme marketing to strategic marketing, from bonus offers to emotion offers, I think this will bring a new era to all of us in managing our relationships and leveraging our relationship with the retail counters.
Absolutely. Very strong points that you have shared with us. And the Chemist is a channel where you get to know the feedback with regard to not only doctor prescription behavior, but also consumer behavior. So, psychographic of patients in terms of are they price conscious or are they getting influenced by the product innovation? Like one of our customers had an innovation in terms of their cough syrup bottle. So it's very difficult to open the cap of the cup syrup. So this company has made it so easy and had a measuring cap. And the chemist got carried away. कि sir ये लीजिए इसमें ये better है. So
Absolutely.
it's just about actually showing him what are the USPs and what you need to talk to the patient. So this is something which, and whereas he had a equally good cough syrup brand in generic, which was giving him 30-40% more margin, but he was so carried away with the brand story in terms of what value it delivers to the patient and let the patient decide. So he is able to educate the patient properly. And with that, we have got the last question for today's webinar that we have planned, and obviously we leave it to the participants to ask questions to our guest. This question is for Govind. Govind, established brands today have a tough competition from generic medicines, and you have to obviously make yourself present as well as lead in that particular position. So, how are you solving this problem of fighting with generic medicines and ensuring that you are taking leadership position?
Okay. So I think so everybody on the panel and in the audience will agree ki this question, when a brand becomes very big or into the mega category, this is the question which every marketer faces with. Ki sir, wo to
True.
sasta de raha hai. Tablet is available at 3 rupees. Our tablet is available at 40 rupees. Same goes for syrup or something according. But before I answer to this question, I've just got one scenario, and it is a very latest thing which I faced, and it was the last month, like as we were discussing yesterday. I had to attend a surgery last week, and the doctor gave a 6-7 line items ka prescriptions across. And there was an antibiotic on it, and it is amongst the top antibiotics, Augmentin. I saw that particular Augmentin, saw that brand Augmentin, and I asked the doctor, ki, ठीक है, you have written Amoxiclav, I'll basically take another brand. What do you think? He gave me a look and he said, ki, you basically please stick to this brand, Augmentin. And I'm trying to be very subtle, what he tried to say me. And the real conversation with the doctor was completely different, which I cannot have on this particular forum. So he said me to stick to augment team. You continue the course for 7 days. Sorry, 14 days. You come back to me after 14 days. We will see, analyze, and let's see how it particularly goes. So, and I had never introduced to him ki I work in Cipla or I am from a pharma marketing background, because the lens from which the doctor sees completely changes. That I've observed 2, 3 times. So what I could understand from that angle was ki the loyalty of the doctor towards that particular brand is very high. And we could understand ki the company who has enforced this loyalty, they did not get this loyalty within 1 or 2 months or within 1 or 2 cycles. They had many touch points. Augmented still has got a very excellent brand story, which they basically passed down the line through their field colleagues, through the chemist counters, through the paramedics coming into the picture, and obviously the trade counters or the trade aspects coming into the picture. That basically shows the loyalty. And once your doctor is loyal with that particular brand, and if he writes it on his prescription, the chemist will never change it.
Never.
He will never dare to go against the doctor. And with those generic aspects or the generic brands, when they're highly available into those tier 2 or the rural aspects, there the doctor loyalty basically comes into the picture. And to basically go to this, the generic competition is inevitable. Let me be very frank with it. Now the thing is key, the panic which comes with that particular generic competition, that is optional. And if you go into that emotional wala part and try to compete on a price basis, obviously after some period of time, 1, 2 cycle, you will have good growth, like you will grow unit wise, you will have something or the other, but on a long run, you will lose. And you think I've got a 100 crore brand, now I have to build it into a mega brand, 400 or 500 crores. Obviously, that vision which you are saying, that will only stay in the boardroom. It will not go out of the boardroom. We have to be very practical when we are competing it with the generic competitions. And in those parameters, the 3 pillars, what I think from my experience is the first, obviously, the clinical depth. As I basically speak on your quality, speak on the trust of the brand, which it generally has for the past 5 years, 10 years, whatever your brand's launch period may be. Speak on that aspects. Try to correlate with the doctor, with the chemist. We are there into the market for so much time. We have touched so many patients. We have sold this many units. Try to build a story. And obviously, the brand story completely resonates with the doctor and the chemist across. Second, obviously, will be the trade confidence, which you give that particular uh, chemist counter across. And third, obviously, I'll speak the execution discipline. You build a brand story, you run it for a quarter, and you feel ki nahi, result nahi hai, let's change the story in the next quarter. And generally, what I've observed ki every new brand plan, there's a new story which is coming into the picture. Pick one point, build on that particular point. Have some new big ideas in those particular brand stories for the doctors and the chemist across. But still, that consistency is what is particularly measured, and it is very practical from a field colleague window. And tactically, if I'll have to speak about key, many things come into the picture, key, how the rotation is happening, how the fill rate is there, how the doctor engagement is there, how the stock depth discipline is particularly maintained. Those particular things basically deep down, or they basically come down from a tactic window. But strategy, if you are very much aligned and you're confident, key, I want to do these 2, 3 things, they should be completely resonating with your brand story across. See,
Absolutely.
lastly, just I would like to say ki if you're on the leadership position of your brand, if you're on the number 1 or number 2 position, there are many follower brands, and they will obviously follow the thing which you do into the market. Rather it be trade offers, rather it be bonus, or rather it be engagement window. And leadership is not only about discounting. Let me be very clear with this. It is basically only defended when you are consistent into this particular market. Yeah, over to you, Ashish.
Thank you so much. I think very valid points. With that, we come to the end of the webinars. There's chat which is buzzing with questions and reactions of what you have shared with us today. Very practical things we have learned today. And my team is going to have a tough time in terms of converting that into an ebook format and encapsulating all the information that we have got today in the past 45 minutes. With that, I would like to also announce the winners for today's webinar. We also have a feedback which I would like to ask you in terms of the quality of the webinar, the topic, and the information which you have received today from us. Please do scan the QR code and give this feedback to us, which help us improve on a monthly basis. We have an intention to get the best of the best speakers, get the best of the best topics which are relevant to your business. And next month, again, we are coming back with an interesting topic, which we are shortlisting very shortly and we'll be announcing it to you. Please do participate. And this will only require the investment of your time. And the returns, what you will be getting is the business impact that you will be observing in your business. So coming to MEDGINI, we started in 2012 and we have been serving the pharma industry in terms of awareness, availability, visibility, and mobility solutions. So these are the four key areas that we are helping pharma companies in terms of not only digital, but also physical ways of doing business smarter, faster, and better. So we are also touching various aspects of business, be it the chemists, doctors, and patients. So we have engagement programs. We have the largest reach of chemists, which is about 5.5 lakhs, and doctors, which is 7.5 lakhs. So keeping that doctor database in place, we have been supporting large companies in terms of go-to-market strategies. So we have been doing that kind of campaigns which are helping them go faster. So we'll be happy to associate with you. Our offices are available in Hyderabad, Mumbai, and Bangalore. And with that, I end this particular webinar and announce the winners to you. The list has come to me, and the winners for today webinar will be announced to you. And before that, I would like to ask our participants if there are any questions that you would like to ask, please do put in the chat and my team will be happy to take it up. And the winners for today's webinar, one is Mr. Ayan Banerjee. Congratulations, Mr. Ayan. And the second winner for today's webinar fitness contest is basically Mr. Tanmay Thakur. So, Mr. Tanmay Thakur and Ayan, congratulations on behalf of the entire team of MEDGINI and the speakers. If you have, do we have Mr. Tanmay, Ayan with us? Can you please spotlight them?
Yes, hi.
Hi, Tanmay. Congratulations.
Thank you
Where
so
are you
much.
joining us from?
Congratulations.
Yeah, thank you so much. The webinar was very interesting.
Thank you.
Like, the very initial part wherein Manish sir talked about building the brand character to chemist, which I have also experienced, and it really works. Basically, even in the era of AI, the human touch point and communication cannot be replaced, is what we experience when we do field work and interact with chemists. And just a small, I will not take much of your time. A good chemist interaction was done along with the team in Kerala, and I'm still getting every alternate month the order comes to me after 3-4 years of that field work. From Manjeri, Kerala, I'm still getting that call, and it makes me smile, to be very honest. It reminds me of that conversation which I had with that chemist. So great insights and a lot of learnings. Thank you so much, Manish sir, Govind, team, Ashish ji, and MEDGINI. I wish you continue to do such insightful webinars for all of us.
Certainly.
Thank you so much.
So, Tanmay, you're joining us from which company, if I can ask so?
I work with Eris Life Sciences, based out of Mumbai.
Thank you. Thank you so much. And Ayan Banerjee, can we please spotlight team? Can you please spot Ayan if he's there with us?
Yeah, hi, thank you.
Hi, Ayan.
And yeah, hi, good afternoon,
He's
Ashish ji.
joining us
And
from Calcutta. We have worked
yes,
together. How has been your
yes,
experience, Ayan?
yeah, thank you. And to take home, I must say here, first was the categorization of the chemist, which was very good. And the second thing was that what can I do beyond schemes for the chemists? So the 3 points which you have highlighted here, those are very much insightful, and let's work on it. So thanks for inviting us.
Right, right. So on behalf of MedGini team, who has worked relentlessly in terms of getting you together, getting the right speaker, getting the right topic, getting the participants, I would like to thank my team for their effort. And to the speakers, we are giving a hard copy of the book, which is Sentiment Analysis for Pharma Marketing, which is of relevance to your business. My team will be happy to get in touch with you again. We have been bothering you from past 2 weeks in terms of the topic, in terms of many things. And we'll be bothering you again in terms of getting your address and getting this copy delivered to you at your doorstep. We'll be happy to have you again as a speaker and get more insightful conversations, which will help pharma marketing to go to the next level. So there are a couple of questions I will like to take that liberty to ask our speakers to please be there with us for 10 minutes and give some insights on questions. So there is one last question which is coming from Darshan, which says that if a brand has limited budgets, how should it prioritize between trade visibility, consumer promotion, and retail incentive to maximize velocity? So, can I ask Manish sir to first address this particular question? What Darshan is asking is, if a brand has limited budget, how should it prioritize between trade visibility, consumer promotion, or retail incentive? If you
Okay,
are
so
a brand manager, what will you do, Manish sir?
my whatever I've been speaking since the start of my webinar, I think I'll maintain the same. The budgets are meant for promoting the brand to the doctors, narrating your story to the
Hmm,
chemist
hmm,
doesn't require any budget. That
hmm,
requires training. So you have to train your people to narrate good stories to the chemist.
hmm,
Building the equity of the brand doesn't require budgets. That
hmm,
requires attitude. And the
hmm,
attitude comes out of training. So you have to be the harbinger of change, my dear friend. You have to convince your field force that building the equity is a future for any brand. So the budgets on trade offers should be minimized to as much as possible. I know it's not possible immediately, but don't try to invest too high there. Be reasonably good there, be moderate there,
hmm.
but invest more on building the equity for the brand. And I'm
True.
sure that you will have a very long run.
Absolutely.
All big brands of the industry are built on equity. They are not built on bonus offers, chemist offers. And yes, some budget can be, it doesn't take too much to educate the retailers. 50 rupees per retailer or 75 rupees per retailer is not a very big thing.
Hmm,
And maybe one to two retailers every headquarter, every three retailers any headquarter is not a very big thing. That's easily
true.
manageable.
Well said. So, Govind, the second question which is coming your way from Mr. Tushar is how relevance of consumer journey or shopper journey can be built in prescription-driven brands. So, what I understand from Mr. Tushar is basically a repeat purchase which is happening of the shopper, right? So how exactly is the relevance of that shopper's journey to be built in prescription-driven brands? So in respiratory category, I understand that most of your brands are of repeat purchase. So how do you solve this puzzle?
Okay. So I think so a very tricky question, but I've faced such kind of problem with respect to the brand which I handled. And when the assignment was given to me, I had also gone to this particular uh, problem initially. And what we did was we developed a patient journey for the doctor, and obviously the chemist part is there. Initially, if it's a very acute symptom which he's facing, he will go to a GP, or if he's into a very rural or a tier 2 to tier 6 city, he will basically go to visit to a chemist, and he will try to get any OTX or a OTC brand across. And for those particular initial phase where he was going to visiting first visit on the chemist, we basically broke down that particular aspects into the 7 parts. First, and these are very simple 7 parts which we just tried to label it, and whatever the first thing basically came into our mind after the primary insights which we were able to pull it. First, obviously, was the symptom. For what symptom he is basically going to that particular chemist. Second was the search. How basically he is basically targeting that particular chemist counter. If it is basically on the need, like on the distance, if it is very near, if he's visiting that counter, or if he's going to a bigger pharmacy chains like Apollo, Noble across. Second, obviously the consultation. Hardly for 5-10 minutes, if he's just going to that particular chemist counter, he's saying, I've got a rash, I've just got a headache. What are the 1 or 2 symptoms initially which he's saying to that particular chemist shop across? And the prescription or the brand which is basically getting narrated from that particular chemist fellow across. And next basically comes the experience of the patient, and then the cycle repeats of the repeat purchase. So right from the symptom to the parameters or to the consultation and then the repeat purchase, these were the 3-4 things which we had basically laid out, and we basically dug deep. And after that, if the symptom or the indication still persists, then he basically goes to the doctor once again. And then we basically built our dig more deep down towards the patient journey for that particular indication across. So for the big or mega brands where the consumer journey needs to be mapped, I would insist you develop a 3-4 steps initially for the chemist aspect. And then when you understand the intervention window, I have to speak on the indication wala part, or I have to speak on the repeat purchase wala part. And then you can obviously, at the later part, you can have your strategies or you can have your tactics according to that intervention part. Like same way we do for the patient journey for a brand, we understand key diagnostic window needs to be increased, the brand adherence needs to be increased. Same way it can be done for the consumer journey from a trade aspect or the chemist aspect.
Perfect. I think you have very simplistically explained the 7-step process of a consumer journey or a patient journey, straight from symptom to purchase. So that is something which we definitely would like to implement and see what are the moments of truth at each and every stage, and what is the intervention that marketing can do to ensure that the patient stick to your brand. So Karthik is asking one question. So this is the last question because of the limitation of time. But Govind and Manish sir, with your liberty, can we share your profile so that the people can connect with you and take this forward?
Sure,
Surely.
sure.
Thank you so
Surely,
much.
why
So
not? It'll
team,
be a pleasure.
please put in the chat the LinkedIn profile of Mr. Govind as well as Manish sir. The last question which we are asking today, Manish sir, if I can ask you on behalf of Karthik. So Karthik says that if I'm having a nutraceutical brand, should I focus on chemists or doctors, and how to improve brand visibility? So this is something which probably you may require more details, but at the look of it, what do you feel, Manish sir? What will
Okay.
you do?
I I have no doubts on my answer that any brand, if you are in an ethical market, my dear friend, and you want to build a brand through the prescription of a doctor, this question should never come to your mind whether a brand should be built at the doctor level or the chemist level. The brand have to be built at the doctor's level.
True.
The doctor is going to write a prescription, write 1 prescription, 2 prescription, 3 prescription. The prescription is going to go to the retailer, and he has to honor it. He is in the duty to honor it.
Yeah.
You only have to narrate your brand story to the retailer. Why your brand is good, why the doctor is prescribing it. Engage him into that decision. That doctor is prescribing your brand, that's all. And even at the level of patients, many a times we say that patient education helps. But for a general brand like a nutraceutical, you can't go to all the patient unless it's very, very specific. So even the patient, hook is going to come from the doctors only. As Govind said, Augmentin लिखा, and when I told कि मैं तो pharma company से हूँ कुछ और ले लूँ, doctor saw him intently and said, "Are you crazy? You have to adhere to only Augmentin." So, dear friend, make your brand character as Augmentin is. Go only to a doctor, and he is going to take away all your problems away.
Absolutely. So it is basically generation and honoring of the generation, which is equally important. But
Absolutely.
generation is the first step. So you don't have
Absolutely.
generation, then
No compromise
keeping.
there. No compromise there. The
Absolutely.
birth of the brand is from the womb of a doctor's prescription.
So great. So we have shared the profile of Manish sir as well as Govind. People who would like to connect, they are very active on LinkedIn. I personally follow them. That's how we got in touch with them. Manish sir, I have been in touch with him for more than 12 years. Govind, I have not met you personally, but will be definitely happy to catch up with you on my next visit. So happy to have you all here and get meaningful insights on today's discussion, which is trade marketing, new age strategies. And I'm sure what we have learned today is practical, implementable, and it's only about the intent which is going to stop us from doing what we want to do. So please do try on whatever you have learned today. And I'm sure the results are there for you. Yeah. So with that, we come to our end of this webinar. Thank you so much. Appreciate your time as well as the energy that you have given to us today.
Thank you, Ashish. Thank you
Thank
so
you.
much. And thank you to all participants for being a part of this webinar. We love
Thank
talking
you.
to all of you.
Thank you
Pleasure.
so much. Thank you.